Antirheumatic drugs. Antirheumatic drugs are a class of drugs indicated to treat the symptoms of rheumatoid arthritis and to modify the course of the disease. These drugs aim to relieve pain, reduce inflammation, reduce or prevent joint damage, and preserve the structure and function of the joints. Antirheumatic drugs are basically classified into four classes: traditional disease-modifying antirheumatic drugs, biological disease-modifying antirheumatic drugs, non-steroidal anti-inflammatory drugs, and corticosteroids. Disease-modifying antirheumatic drugs are the agents that modify the progression of disease, which are recommended for progressing rheumatoid arthritis that is not responding to non-steroidal anti-inflammatory drugs. These drugs have no analgesic effects. They usually take 6 weeks to 6 months to show results. Disease-modifying antirheumatic drugs may be given in combinations to enhance the efficacy of the drugs. Methotrexate is a first-choice disease-modifying antirheumatic drug. It is a folic acid antagonist with cytotoxic and immunosuppressant activity. It acts by inhibiting dehydrofolate reductase, leading to the inhibition of cytokine production, chemotaxis, cell-mediated immune reaction, and proliferation of immune cells. Sulfasalazine is a compound of sulfapyridine and 5-aminosalicylic acid which acts locally to decrease inflammatory response and systemically inhibits prostaglandin synthesis. It is used alone in mild diseases or in combined with other drugs in severe cases. Hydroxychloroquine is primarily anti-malarial drug, which is approved for the treatment of acute or chronic rheumatoid arthritis. It acts by suppressing lysosomal enzymes and inhibiting interleukin-1 release. It also suppresses T-cell lymphocyte response, leukocyte chemotaxis, and traps free radicals. Prolonged administration of hydroxychloroquine may cause corneal opacity and retinal damage. Biological disease-modifying antirheumatic drugs are genetically engineered protein molecules that block pro-inflammatory cytokines. These drugs may be effective when other disease-modifying antirheumatic drugs fail to achieve adequate responses. They are expensive compared to traditional disease-modifying antirheumatic drugs. Infliximab is a chimeric immunoglobulin G1 monoclonal antibody. It binds with high affinity to soluble and membrane-bound tumor necrosis factor alpha and prevents its interaction with cell surface receptors, causing downregulation of macrophages and T-cell. Anakinra is a recombinant human interleukin-1 receptor antagonist. They are clinically less effective than tumor necrosis factor inhibitors. It is used in refractory rheumatoid arthritis. Abatacept is a soluble recombinant fusion protein. It competes with CD28 for binding on CD80 or CD86 protein, thereby preventing full T-cell activation. It is indicated for patients with moderate to severe arthritis and for those with inadequate response to disease-modifying antirheumatic drugs or tumor necrosis factor alpha inhibitors. Non-steroidal anti-inflammatory drugs are the first-line drugs used in mild or early cases of rheumatoid arthritis. It is recommended for relief of pain, swelling, morning stiffness. They do not arrest disease process. They work by blocking cyclooxygenase enzymes, thereby reducing the production of prostaglandins, which are involved in the generation of the inflammatory responses. Corticosteroids can retard the rate of joint destruction and relieve synovitis in low doses. They have mild disease-modifying potential. Corticosteroids are used as a bridge therapy for the treatment of rheumatic flares, rheumatic vasculitis and interstitial lung disease, and as a bridge therapy for 6 to 8 weeks before the action of disease-modifying anti-rheumatic drugs. Antirheumatic drugs should not be used in immunodeficiency syndromes and active infections, such as tuberculosis, hepatitis B. It must be avoided in pregnancy or breastfeeding and should be used with caution in patients with moderate to severe hepatic impairment. One should seek medical advice if signs of allergic reaction like severe skin rash that causes blistering or peeling of skin develop.